I'm Dr. Joe, a GONSTEAD chiropractor here at GONSTEAD CARE in Shanghai. In our last video, we talked about the SI joint pain. That lesson was very important because it showed us something simple. Pain is not always where the real problem begins. A small shift in the pelvis or sacrum can change the way the whole spine moves. Today we are going one level deeper into a condition many patients are very worried about: spinal stenosis. Maybe you were told your spine canal is narrow, you have nerve compression. Maybe you were told injections are next step or that surgery may be necessary later. I want you to slow down for a moment. This video will give you information that you need for spinal stenosis and may give you a chance to avoid unnecessary pain, medication, injection, and spinal surgeries. Please share this content with someone who has spinal stenosis. You can help reduce the pain in this world. Spinal stenosis can be serious, but it is not just a word on MRI report. We need to understand what types of stenosis it is, why the nerve is irritated, what mechanical stress is creating the problem, and what role spinal alignment and muscle stability play. So today we are going to look at spinal stenosis from a practical, patient-friendly, concept-focused perspective. Not chasing symptoms, but understanding the root cause. Let's begin with the core problem. The word stenosis simply means narrowing. In the spine, the narrowing usually affects the space where the spinal cord, nerve roots, or exceeding spinal nerves travel. There are two common types we need to understand. The first is central canal stenosis. It means the main spinal canal becomes narrowed. In the lower back, this can affect the bundle of nerve that travels down through the lumbar spine. The second is foraminal stenosis. The foramen is a small opening on the side of the spine where each nerve exits. If that opening becomes smaller, the nerve root can become irritated or compressed. Dr. Joe, why does the space become narrow? There are several mechanical reasons. The disc may lose height due to lack of motion from long-term subluxation. It can come from the lumbar itself or pelvis or both. Usual cases are both. The joints in the back of the spine, called facet joints, may become enlarged or irritated, as I told from the previous video. Subluxation changes segmental joint motion, that is why chiropractors use the diagnostic term segmental dysfunction on the medical record. I have been talking numerous times. If the joint is losing its own motion within their normal range, it will start degeneration process. Ligaments may be thickened, bone spur may develop, and sometimes the spine shifts in the way that reduces the available space around the nerve. But here's the key point. The MRI shows us the shape of the structure, but it does not always explain the whole story. Some people having narrowing on MRI, but these people barely having no symptom at all. Other people having moderate finding but severe pain. They are not able to sit, stand, moving around. Numbness, heaviness, or weakness altogether. So we must ask or change to a better question. What is making the nerve irritation in that person at that moment? This is much closer to the core key question. If one segment is not moving correctly, if the pelvis is tilted, or if the surrounding muscles are guarding, the nerve may experience more stress even before the MRI looks severe. That is why spinal stenosis is not only an imaging condition. It is a mechanical and functional problem. In the GONSTEAD chiropractic system, we do not simply chase the pain. We look for the specific structure shift, which we call subluxation. That changes the way the spine bears weight and protects the nerve from external forces and internal forces as well. Think about your spine like a building. If the foundation is balanced, the load travels through the structure evenly. But if one section shifts, the pressure does not disappear. It gets transferred somewhere else. In spinal stenosis, that pressure often concentrates around the lumbar spine, typically lower lumbar spine. The disc space may already be reduced, the joints may already under stress. Then if there is a subluxation, a structural misalignment, altered joint motion, and nerve irritation, the available space around the nerve can be even smaller. This is why stenosis patient describes a very specific term called neurogenic claudication. They say, when I walk, my legs feels heavy, or after a few minutes, I need to sit down, or standing upright makes it worse, but leaning forward or sitting gives a relief. Why does that happen? When you stand tall or walk, the lumbar spine often moves into extension. Extension can reduce the space in the spinal canal and the foramen. But when you sit or bend slightly forward, the canal often opens a little bit, so the nerve feels less compressed. This is why some people with stenosis say they can ride bicycle longer than they walk. On a bicycle, the spine is flexed forward. Walking upright may close the space more. From a GONSTEAD chiropractic perspective, we want to identify the exact segment that is not functioning properly, exact segment, which is key to restore normal motion to the spinal stenosis. If there is a subluxation at the bottom of the spine that creates stenosis above or within itself, we examine posture, pelvic balance, spinal motion, nerve signs, muscle guarding, and X-ray structure and X-ray analysis all combined to determine whether the patient has a subluxation or not. The goal is not to force the spine. Real goal is to restore better mechanical function, so the nerve is not constantly being irritated or compressed, and the spinal disc has restored joint movement. Now let's talk about the very common myth. Many patients hear the word spinal stenosis and immediately think, I will eventually need surgery. But that's not always true. Yes, there are situations where medical intervention is necessary. If there is a progressive weakness, loss of bladder or bowel control, severe neurological compromise, or rapid worsening symptoms, you need to seek urgent medical care. That's not something you want to ignore. But many patients are not in that emergency category at the first place. They have chronic back pain, leg symptoms, numbness, heaviness, or walking limitation. But they still have the room to improve their mechanical function. Another myth is that MRI alone decides your future. Imaging is a very useful tool, but it does not show the patient's joint movement pattern. As a doctor, we have to compare the imaging with your symptom, your neurological exam, your posture, your movement pattern, your history, and how your body responds to conservative care. Some people are told the canal is narrowing, so nothing can be done except injection or surgery. But we have to be careful with that conclusion. If the joint is locked or moving or not moving properly, if the pelvis is unstable, if the muscles are guarding, adding extra pressure toward the bad joints, if the hips are stiff, if the core cannot stabilize the lumbar spine, then the stenosis symptoms may be amplified by poor mechanics. This is where conservative care can be meaningful. We are not protecting to make bone spur disappear overnight. We are not claiming to reverse every degenerative changes, but we are asking, can we reduce mechanical stress, improve alignment, improve motion, and build better stability around the spine? For many patients, that question is worth asking before jumping to more invasive choices. Remember, the body is an integrated system. You cannot look at the spinal stenosis in isolation. The lumbar spine sits on top of the pelvis. The pelvis connects to the sacrum through the SI joints, and the pelvis also connects to the hip, knees, ankle, and feet. So if the pelvis is rotated, if the hip is restricted, if the one foot changes the way you load weight, your lumbar spine has to compensate. That's the physics. Nobody can avoid those things. Gravity is pulling us down. Let's connect this to the last video on SI joint pain. If the SI joint is irritated or unstable, the pelvis may stop transferring force smoothly. Then the lower lumbar spine may take more stress. Over time, that extra stress can affect the disc, facet joint, and surrounding soft tissues. Add spinal stenosis to that situation. The nerve already has less space. If the pelvis and hips do not move well, each step can create more compensation and irritation around the lower back. This is why some stenosis patients feel worse after walking downhill, standing for a long time, or standing the back. It is not only about the spine itself, it is about how the entire kinetic chain loads the spine. The hips are especially important. If the hips are stiff, the lumbar spine may overextend it or rotate too much. If the glutes are weak, the lower back may do work that the hips should be doing. In the abdominal wall cannot create stable pressure toward the lumbar spine. The spine becomes less protected during movement. So when I evaluate patient with the spinal stenosis, I'm not only looking at the X-ray or MRI level. I'm looking at the person standing in front of me. How do they stand? Is their balanced shoulder height? Is the pelvis level? Are the hips moving well? Are the muscles guarding? Is the spinal stabilizer strong enough? Is the spine compensating above or below the painful area? This is the difference between treating the picture and treating a human body. So what can you do right now? Besides obvious things like spinal adjustment, first, do not force aggressive back extension like Mackenzie style exercise at the first moment. It can be good exercise once you restore all of the motion and subluxation. If you haven't done dealing with the subluxation, it is clear it will increase your leg symptom. Some exercises are good for one condition but not ideal for another. If standing tall, arching backward, or walking downhill creates heaviness, numbness, or pain down the leg, respect that signal. Second, learn to find a neutral spine. Neutral does not mean stiff. It means your spine is not collapsed, not overarched, and not twisted. When you sit or stand, imagine your ribcage stacked over your pelvis. Your lower back should feel supported, not compressed. Third, gentle position that reduces irritation. For some stenosis patients, sitting with feet grounded and the body slightly supported forward can calm the nerve. This is not cure, obviously, but it can reduce the immediate stress to the spine. Fourth, build stability before intensity. Many patients try to stretch harder or exercise harder, but their spine is not stable enough yet. Start with the breathing. Diaphragmatic breathing is really important thing. That's one of the basic things given to the body. Make sure you have those. Abdominal control, glute activation, and controlled hip movement. The goal is not to make your back tired. The goal is to teach the spine that is safe and supported. You're looking for a conservative path. The priority is clear. Get specific spinal adjustment. Reduce the nerve irritation first. Correct the mechanical stress first. And build the muscle stability around the spine. Let's summarize today's lesson. Number 1. Spinal stenosis means narrowing around the nerve, but the MRI is only one part of the story. Symptoms depends on the structure, the nerve, the movement pattern, and the stability of the whole body. Number 2, from a GONSTEAD chiropractic perspective, we look for the specific structural shift, subluxation. We need to fix this. We want to know where the spine is losing proper alignment and motion and creating nerve irritation, because that's the place your nerve irritation can become worse over time. Number 3, spinal stenosis connected to the kinetic chain. The pelvis, SI joint, hip joints, and core stability all influence how stress reaches the lower lumbar spine. And number 4, conservative care is not about ignoring degeneration. It is about improving what can be improved. Alignment, motion, stability before moving toward unnecessary drug, injection, or surgery. The goal is not just feeling better for one day. The goal is to help your body function better, so the healing has optimal environment help nearby damaged tissue. Thanks for joining me here at GONSTEAD CARE. Today we learned that spinal stenosis is not just about the narrow canal. It is about structure, nerve space, posture, muscle stability, and the whole kinetic chain work together. Video we build directly on this and look at degenerative disc disease, what it really means, why disc height changes, and how spinal mechanics influence disc health. Remember, your body is designed to heal when the interference is removed and the structure is supported correctly. It's been Dr. Joe. I will see you in the next video.